Hi everyone, welcome back to D Squared Classroom. So far we've talked a little bit about the anatomy and physiology of the heart, we've talked a little bit about blood flow, and next I want to talk about the cardiac cycle, which in a way puts those things together. And there's a lot of different aspects of the cardiac cycle. You can look at an EKG, which we'll do in the future. You can talk about heart sounds and pressure and volume. Today we're going to focus on pressure, which I think really forms the basis for understanding the different phases of the cardiac cycle. So let's jump in. There are two phases to the cardiac cycle. The first is called diastole, which is when the heart is at rest and essentially when the heart is filling with blood, and specifically when the ventricles are filling with blood. And then the second phase is called systole, which is when the heart actually pumps and blood is ejected from the ventricles and leaves the heart. So if we zoom in on the heart itself, you'll see that diastole is that filling process and the ventricles kind of puff out. And then systole is when the valves to the aorta and the pulmonary artery open and the heart pumps that blood out to the rest of the body. Now, if I were to put that in graphical form, I would show time on the x-axis and pressure on the y-axis. And I'm going to use three different colors to indicate the pressure over time for the ventricles, the aorta, and the two atria. So beginning with ventricular pressure shown in green, and we'll focus on the left ventricle because that tends to be where pressure is higher. It starts relatively flat and then it substantially increases, which is when the heart contracts or squeezes in order to eject that blood from the left ventricle into the aorta. And then the pressure comes back down once the blood leaves and starts all over again. Now, if we were to focus in on that point at which the pressure increases, it's when the valves between the atria and the ventricles or the mitral and tricuspid valve close. Now, again, we're focusing on the left side, so we'll focus on the mitral valve. Now, I've drawn a red line here to indicate the start of systole. So when that valve closes, that's when the heart is starting the new phase of contracting in order to get the blood out of the heart and to the rest of the body. At the end of that contraction, and once the blood has left and the pressure comes back down, that's when we move into diastole, and that's shown in purple. So at this point, the heart is at rest, the pressure is back down, and then we start again with systole. Moving on to aortic pressure, it's similar to ventricular pressure in that it starts relatively flat and then it starts to increase as the heart ejects. And you get this little notch if we were to zoom in when the aortic valve closes. That's called the dicrotic notch. And it happens because the pressure gets a little bit of a dip as you close the valve and the pressure starts to increase again from the blood that's just entered the aorta. And lastly, we'll discuss atrial pressure, which is shown in yellow and remains relatively flat in comparison to the ventricular and aortic pressure, but still you can see has different characteristics in the different phases of the cardiac cycle. Please tune in next week when we will be discussing heart sounds.